Again, a warm welcome everyone for having joined this talk for menopause. But basically, again, let me clarify that this is not something that's going to only focus about menopause as such. It's, I think, a general information about the women's health, which I think all should know about, irrespective of whether they are females or males as well. Now, why I was inspired to talk on this, because having interacted with a lot of people, I found that there were a lot of lack of information among the people, and that's what inspired me to call out for this talk. Now, just a brief introduction about my own self. Uh, my name is Dr. Om. I am a naturopath. I have done my bachelor's in naturopathy and yogic sciences from India. And I'm also a student of Ayurveda and also learning on medical astrology. Now, why I call myself a student of Ayurveda is because now having done your bachelor's or even master's, you sort of always get some degrees or certificates after you have completed successfully the courses. But incidentally, the study about Ayurveda is so vast and the subject is so deep that I'm sure no one person can finish the studies in one lifetime. So one has to remain a student all its life, and one should be willing to learn also all its life. So now, as I said, having discussed with a lot of people, I found that there was a lot of gray areas about, not understanding your own body properly. And that is why it's so much of misinformation and so much of panic around this topic of menopause. So I thought, okay, I will hold a talk and then I want to basically go over the main purpose or objective of this meeting. Now, I don't want this meeting to be only just held as a call for information receiving, but what I intend to do also in the long term is to create a community of people, who are actually more aware and more keen on establishing good health, and also trying to help others in the same say journey, so to say, because we see that everyone needs some help or the other every time with when it comes to maintaining good health. And being a naturopath, I always want to encourage people to sort of try the natural way of healing yourself, because your body itself has the innate capability of healing itself, which is what we are at times forgetting. Not at times, and most of the times. And no matter if we have a small health issue, we rush to the doctors and we get medications from them. And sometimes when you visit a doctor and he doesn't give you much medicines, it's much to your disappointment. See, I went to the doctor and he gave me only this much. So no, it's not worth the bill that I have paid. Come on, that's not the way to approach. And because at the end of the day, these chemical medicines are doing a lot of harm also to your body. So you should be rather happy that he has given you a lesser medical support in that sense, and then your body can actually trigger on its own capability of healing itself, and whatever he found was most appropriate to get as the medicine, he has given you that. And as you know now, in olden days, there were not all these doctors around and big five-star hotel or five-star hospitals around that were able to provide such sophisticated treatments. But the people were still getting healed, and there were no talk of such complicated health issues that are being heard of these days. So basically, what we want to tap on is that internal potential of every human being that is capable of healing your own self. And now looking at menopause. Now menopause is, it's not a disease, it's not a medical disorder, but at the same time, it's something that triggers a lot of discomfort. And this needs to be definitely addressed properly. Now, incidentally, since the patients, or I don't want to really use the word patients in that case, but yes, the females who are going through menopause or in the perimenopausal phase, they are experiencing a lot of symptoms, but at the end of the day, it is that they're not really like cash cows for the medical industries. Do you understand what I mean? So they are not going to be contributing to the heavy billing of the hospitals. So they are never going to be given the right focus. So I felt that menopause, or the journey through menopause, is not really also given its due consideration, in the sense that how important it is to sort of address this important issue, and yet it is not done so. So that's why I thought it's better to have a talk and make the people help themselves in a way to be able to get to a better quality of life. So the expected takeaways, what I would say from this talk, is basically to raise the awareness to deal with this phase of life, and also to ensure a smoother health and healthier life trajectory. Because what's most important is the post-menopausal phase. That is where your body is actually getting much older, and you are feeling the need of um, more help in that scenario. So if you're more aware in the early years of your life, you are able to maintain a better health. And studies and data show in that today's world, the percentage of females making to their postmenopausal life is much higher. So obviously, I mean, the longevity is improving thanks to all the medical facilities that they are available these days. But again, we don't want to just drag on to the age numbers. The main idea is to be able to have a good quality life in your old age. So that's also one of the key points that I had in my mind while I wanted to hold this talk.